You got a final, before we wrap up, do you have a final tip or something you would like to share with everyone? Bit of wisdom before we close off.
Well, I would just reiterate the thirst for knowledge that you've talked about. I think it's always good to run things by colleagues. Look, I'm going to give you an example. I was talking to somebody about differentiating, again, compartment syndrome from medial stress syndrome. And I talked to one colleague, and he had a great idea. He said, you could do an ultrasound, have the patient run, because that WIC catheter, that Stryker catheter, very painful, right?
Yeah.
And you really want to be fairly sure that it's a compartment syndrome. This was a particular patient that had ruled out with an MRI for any kind of fracture. But anyway, the short of it is that collaboration gave me an idea. Why not try an exercise exertion ultrasound and a pre-ultrasound and see if there's a difference? That'd be a good way to see the tissue changes in that. And then another colleague that sees a little bit more of compartment syndrome, he said, what I hang on, I just had lunch with him today. We had Doctor's Day here in the US, orthopedic surgeon. And he's saying, what I hang on? I hang on the story. If the patient tells me that their leg feels like it's going to explode, that to me is the compelling bit to get the compartment pressures, to get that tested. So I think like that thirst for knowledge and going the extra mile, because even you get an MRI, the MRI guy said, what you could have done too, if you wanted to see something, had the guy run first and then get the MRI, which I said, yeah, should have done that, but it's like, so I think that if you keep pushing for another iteration, you're going to get more and more specific and more technical and more astute at the best way to solve a problem and to diagnose a problem. So that would be my clinical tip.
So just thirst for knowledge.
Keep going forward. Yeah.
Yep, that's great. So Ben, I want to thank you for coming on the Podiatry Legends podcast, sharing part of your story and your wisdom in this area of sports podiatry. And when you get more details about your biomechanics summit as it comes up, please forward them on to me. But you're already in the Podiatry Business Owners Club on Facebook. So if anyone's listening to this and you want to join the Podiatry Business Owners Club on Facebook, come on over. All you need to do is answer 3 simple questions and you're in. So you're already a member there. So you can just post straight into the group, and yeah, I just approve them when they come through.
I appreciate that, and I look forward to continuing collaboration, both like this and on the web.
Yes. Okay. I'll talk to you again soon. Bye.
Okay. Bye. Thank you.